Good morning, ladies and gentlemen, and distinguished panelists. I would just like to add on with my presentation to the rich databases that have been mentioned by Mr. Rajneesh. That's to the health database. And let's see how we move forward. Before that, I'd like to introduce myself. I'm Ritu Ghosh from HP. I'm in a part of the government affairs team driving the education, health, and environment verticals. Today I'll be sharing about a very unique and an innovative infrastructure solution which generally a common man refers to whenever we talk about it as a magic box, but this is a village health center. And before I present more details and facts onto it, I would just like to begin by sharing a few facts on the status of the health scenario in the country, which is we all of us are aware of. We already know that we are a population of 1.2 billion and we are increasing at a rate of 2% per annum. And we have seen, because of the development in IT, a considerable growth in the elderly population. Because of the health conditions improving, the life expectancy rate is increasing. And hence we have a growing elderly population, which means adding on to the increasing rate at 2% per annum, the responsibility on the health infrastructure is to handle a large base of population. Because of the increasing developments and the IT moving into each and every sphere, we have seen a decline in the infant mortality rate and maternal mortality rate. However, we cannot ignore few of the figures that are very, very alarming in spite of the decline that we are seeing. In 2000, we had 136,000 mothers who died in childbirth, and this is the highest in the world. And there is one maternal mortality happening every 7 minutes. And almost half of the pregnant women do not get any antenatal checkup done. They are not aware on the healthcare needs, the requirements. They are not educated on what is important. A very simple method could prevent them from moving into this kind of a statistics and a situation, but it's just the non-awareness that's there. 1 million children die every year before they become 28 years old. 20 days old. And in fact, even before they reach the age of 14, the children, they die because of malnutrition. So now the question arises, where the gap lies? Why are these figures so very alarming? The very crucial fact remains that just 27% of the population is residing in the urban area, yet the healthcare facilities, 75% of them are concentrated in the urban areas. Needless to mention, the healthcare facilities in urban areas have their own challenges, but the concentration and awareness is only 25%, so there is a huge gap vis-a-vis the concentration of the population and the availability of the doctors, the availability of the healthcare. Generally, we find villages, they do not have hospitals. If at all there are hospitals, they are not well equipped, or the equipments are there, but the doctors are not visiting. Doctors are willing to visit, but there is no support. And to add on to it, there is a huge gap in the infrastructural support. There is no electricity. And if we talk about the presence of the equipment, the IT, the presence of the ICT, the presence of the mere computers and the internet, that is a big question mark. The last mile health infrastructure that is available and accessible to the villages is primary health center. However, there we see that there is a huge gap as per the population ratio and the availability of the PHCs that is there right now. It is expected and it is required at least 75,000 PHC per 1 million population, whereas the fact is that more PHCs need to come up. If at the existing state we wait for more PHCs to come up, even with all of the resources being pumped in, it will take highly time for the construction, for integration of the infrastructure, as I mentioned, electricity, connectivity, equipment, medical equipment, other equipments, the manpower being available. Integration would take a longer time. So there is a challenge in ensuring an infrastructure which can be made readily available, which is self-sufficient, pre-fitted, and can be deployed from day one. It can be operational from day one. Also, there is a need. We used to have earlier in the urban culture also a culture of a family physician being there. So something which was simple, which was accessible, and I could just approach for my health problems and health needs, not at a very distant, but they are very approachable solutions. So there was a need felt wherein I could integrate the infrastructure, which is self-sufficient, and it could be rapidly deployed, and it has advantages of the equipment, like a basic equipment, ultrasound, ECG being available, medical staff being available, and it is approachable and simple. There is and when this particular magic box came into existence, a container, a normal shipping container was taken, it was fabricated, it was pre-fitted with all the requirements and converted into a village health center, which is a toned-down version of a primary health center. It has built-in electricity, it has built-in connectivity, it is equipped with the basic medical equipments, it is biometric enabled, it has got VSAT connectivity, as I mentioned, and very, very importantly, it is not dependent on any external infrastructure availability, to the extent that we have supply chain. The shipping container in itself is robust enough, it is waterproof, it can be carried to any place, mountains, to seas, to deserts, and it can be plonged there. From day one, it can become operational. Is the magic of this particular infrastructure only because it is a standalone infrastructure which is self-sufficient? No. If it is a standalone infrastructure which is self-sufficient, it will become redundant. It will also become too complex to become accessible to a normal villager. The beauty of it lies that there are so many such VHCs available all across in every village. So it actually increases the reach of the healthcare infrastructure, and they are all connected to a data center, to a health cloud in the back end, wherein all the complexities lie, which adhere to the standards of what a health database, of what a health provision, of what a health technical architecture should look like. And then even an expert sitting in London or an expert sitting in India's best hospital can be accessed by a villager who probably now, even for a diagnosis of a simple fever, which could be a malaria, which could be life-threatening, has to walk miles and miles, and not knowing whether the place where he is going, there will be a bed available there, there will be a doctor available there, will he get an appointment or not? To add to it, it is not only accessible and simple in the front end, but it is also very low cost. At a total cost of an equipment being less than 90 lakhs, you can set up this particular infrastructure. It dramatically increases the reach of healthcare. The remote monitoring and functioning of the equipments can be done, so it doesn't need somebody as a policeman to be there. Even if we have the basic doctors visiting this particular place, the equipments installed there, the output of the equipments can be remotely monitored. The functionality of these can go into the database of the health, which can be monitored from anywhere. Then it improves the antenatal and postnatal care. It addresses the basic health issues and delivering the preventive health care such as immunization. Not only this, with the use of technology, you can have simple...
Ma'am, 1/4 of a second, please.
Okay, sure. Not only this, but from the improved technology, a simple thing like sending SMSs for vaccination reminders, for TB drug administration. This can really help a simple villager to get reminded of what is the practice followed in a TB drug administration, and it can be life-saving for him. I'll just show you a few of the images of how the layout looks like. What do we gain? There's a reduced mortality and enhanced quality of life for patients, reduced IMR and MMR, the access to primary healthcare facility and better care. It is affordable. The diagnostic tools are low in cost. They are available. There's a facility of video conferencing for telemedicine. It gives a feel that yes, you are being diagnosed. Although there are doctors available, but whenever you have to seek an expert opinion, even a doctor at a village health
Madam,
center
1/10 of a second.
can seek the expert advice of a doctor sitting remotely as well. What does the government gain? Enable rapid rollout of statewide healthcare. It significantly increases the reach of healthcare and the ability to monitor disease surveillance, and to add on to it, very, very important, the actual data on health, the health database which can be built in from here. You can actually, a patient who comes for a diagnosis here, his entire diagnosis, obviously keeping into account the privacy issues, can be made available for research and development, can be used for the policy initiatives, for the data used for the policy initiatives by the government. This is our first site in a village in Chausala in Haryana, where this is being deployed. Thank you.